Hello, this is John Minarsik in Lake Bluff, Illinois. I have been asked by Davis Wood and Kat Waldron to comment on some of the histologic features of the Tasmanian devil facial tumor. This disease was actually made known to me only recently, although I had heard about it in passing because I had a pet in the Caribbean that was affected with a tumor involving the urethra, which I was told was very similar to this disease in many respects. And now I have received some PowerPoint images from Davis, as well as some excellent histologic material, which I would like to comment about. I guess we should always talk about the gross and in vivo features first. You can see this is a Tasmanian devil. Here's the ear. You can see there's the closed eye, nose, mouth. And in the neck region here, you can see that there are some ulcerated nodules. I believe these are probably naturally ulcerated because of the irregular margins rather than cut margins. The tumor itself, when cut in half, has a nodular appearance. You could see in areas it's separated by bands of fibrous tissue. And here you could see that it's hemorrhagic in the middle, but for the most part all of this white fleshy material is tumor, and the bulk of the tumor itself looks like it is not separated by fibrous tissue, which is very typical of lymphomas and many other non-lymphoma quickly growing neoplasms. Here are some of the tumor cells, which surprisingly are very monotonous, uniform, round. And although this is not the usual H&E technique, this is the DIF-QUIC, which is a modification of the right stain, or the stain we use for blood smears. You can see the cells, although some are very pleomorphic and hyperchromatic, for the most part they are not very variable in size and shape. I believe some of these cells here may very well be lymphocytes, but obviously these tumor groups, you can see the tumor cells look a lot like each other. In a section from the skin, which you see here, this being the epidermis and this being the dermis, you can see the tumor cells, the dark blue cells, infiltrate quite diffusely, reminiscent of a lot of lymphomas. And you can see that there is basically a very streaming pattern of growth, like it was to be expected clinically, that these are very fast growing tumors, which is why they have decimated much of the populations of the Tasmanian devils in eastern Tasmania. Here's a higher power view of the cells, and certainly in the south west over here, these are virtually all tumor cells. Here are a few more tumor cells, which you could see here, perhaps mixed in with some fibrin and perhaps inflammatory cells. But the tumor cells here, you could see, have a lot of intranuclear inclusions. I would be very hard pressed to call these things nucleoli, especially areas like here and here. It looks like it's a diffuse clumping of the chromatin. This is a picture which was reported to me to have come from within a coronary artery. I really doubt that. It may very well be, but I have not really seen too many metastases to inside of a coronary artery. Nevertheless, whether it was or not, you could see in this picture here, the tumor's cells appear to have a little bit more cytoplasm, reminiscent of some of the epithelial malignancies, like a squamous cell carcinoma, for example. And if that is not confusing enough, whereas I mentioned in this slide the tumor looked like a lymphoma, and in this slide it looks like a carcinoma, the actual studies from science make it appear that the cells themselves may be of neuroendocrine origin, or perhaps Schwann cell, which is regarded as a type of neural crest derived cell as well. Here's another picture of the tumor cells, and in some cases, like here, you have a very bizarre mitosis. Otherwise, the tumor cells exhibit all of the features of pleomorphism and hyperchromasia that you would expect from a high-grade malignancy. When you see a cell anywhere in which the chromosomes look like they're dividing in more than one direction, that's almost always the sign of a malignant cell. Last cell here is metastasis from the pituitary, and these cells up here in the upper area, the red cells with the red cytoplasm, they may very well be either eosinophils or perhaps chromophobes, hard to say, but certainly all of the cells in the lower field and most of the western part are once again pleomorphic tumor cells. I think a lot of work needs to be done on this type of tumor. It has some very, very unusual features, which I had been musing about when my dog got the disease in the urethra, which is a venereal form. Luckily, he was cured with surgery and chemo, and he's doing fine now, but apparently, whether this is the same type of process going on to the Tasmanian devils, I'm not sure, but it certainly is a very, very nasty one. I wish I knew more about the disease, and I'm going to plan to learn more. Thank you very much, Davis Wood and Kat Waldron, for sending me this material. If you don't get a damn A on your project, I'll give you one myself. Goodbye, and thank you very much.